Henry Waxman is the one that cast it. So they don't want to be subject to the same laws. And if you remember anything about Newt Gingrich's revolution, it was that we should all be subject to the same laws.
Yeah.
Listen, that's the lady here.
Listen to President Obama in New Hampshire town hall meeting today, and I think he unwittingly gave an excellent example. He compared the post office to FedEx and UPS. Well, the post office is bankrupt. They're raising rates every few months, and they're also giving mediocre service. But in this discussion, all of a sudden we have a crisis, a medical crisis. What's happening with Social Security? I mean, that's probably the largest government-funded thing, and the last I heard, it was going to be bankrupt by the time I retired.
Yeah, and in the plan, if this series of bills is successful, in the next year of Congress, you will see a Social Security reform bill. And the reform bill will be to raise the maximum that you can be taxed, and that will go up precipitously. It's kind of class warfare, but if that will go up, if you did that, you provide enough actuarial money to bump that number far enough out to where they can say we fixed it.
So instead of capping it at, I think it's at 140 right now, or
no, it's really like 105 or something like that. But yeah, that doesn't affect, doesn't affect 80% of the tech. But that is where the big amount. So if you took the cap off of it, for instance, which there is, I don't think there's a cap on that. What is the cap on Medicaid?
there isn't. I don't think there's a cap.
No, see, that's the same concept, and you follow that. And then you means test the benefits. That's your 1-2 punch, and that can buy you 40 years actuarially. I would be against that because it raises taxes, but I'm just telling you that's what you can look for down the road.
We have a severe shortage of doctors and nurses. If we increase the demand and we don't increase that supply, where is that going to come from?
Well, I told my dad's 89, and we have a lot of experience with the healthcare system. I had to sit in the office with my dad last year when some guy misread a test and told my dad that he had cancer. And we went through test after test after test after test, doctor after doctor after doctor, only to find out that it was a shadow on the deal, and the guy, and so after about a year, he didn't have cancer. But we went through this entire year, and my dad said, well, Kenny, why are you so against, this public plan? I said, Daddy, every time you try to get an appointment at the doctor, you're competing with X number of people for that appointment. If you give 40 million people a plastic card that says, come on, then you're going to begin to compete with that many more people for an appointment at your doctor, because we could gear up the medical system, we could gear up, but Dalton can tell you how difficult it is to retain doctors and nurses especially, because there's got to be, several nurses for every doctor. So this is a chronic problem. You put your finger on it. And these are the kind of conclusions that people are coming to when they're watching TV at night. They're thinking, because they're common sense. Yes, ma'am.
If you think you have mistakes with your father, when you multiply that with more tests, with the same people having to read those tests, you're going to have more accidents. You're going to have more mistakes. I had a deviating septum anyway. They took a CAT scan X-ray of my sinuses. But because they had blinders on, they said, oh yeah, you have deviated septum. They didn't notice that I had a lesion in my jaw, which my jaw had been eaten away. When you have more and more people in the system, They're gonna have more tests, you're gonna have more errors, and people are gonna be falling through the cracks, and they're not gonna be.
Well, we
quick.
have trainings on the system now.
Yes, that's what I'm saying.
There
It's
is
worse.
a system though now. It's not a good system because it's emergency room oriented.
Yes.
But this puts a strain very quickly on it, and I'm afraid that those on Medicare are going to be the most affected, the quickest. Yes, sir.
First of all, my background is banking, that's been a challenge in itself.
Yeah, Dave.
I said my background is banking, and it's been a challenge in itself. For the Treasury
Well,
Department.
bankers are all speaking softly these days. Yeah.
This is not from,
Yeah, I understand.
well, no, probably from Treasury Department, but moving to the health, back to it. I think the Senate can be touched and reached, because there's not, I think there's still a number of Republican senators who can have an effect on this bill that is passed.
Absolutely, yeah.
And I think that needs to be done first. That way, it brings some of this to light and brings us all into the scope. Having been not a victim of cancer, but my wife with cancer, and having lived through it for 2 years now, and watching a young child who lost her mother last week at the age of 45 from cancer. It's very dear and close to me. My question is, we hear the public, but what is your plan? What is your take, and what would you propose?
Well, here's what, I would propose that we deal with that 15 million people first. Before I propose that though, I would spend 24 hours a day, 7 days a week, trying to get this economy and jobs back up. Because if 3 or 4 million people are reemployed, the chances are that 3 or 4 million people will get their health care back. I would spend my time on the economy. I would have businesses, large and small, in to the White House. I hate to compliment Clinton, but you remember that the first thing Clinton did was he assembled a round table of businesses and looked at them and said, what can you do to start employing more people and getting this economy back on? That's the first thing I would do. Once I had the economy where it was trending back and unemployment was going down and people were putting back on, then I'd begin to focus on this 15 million people. Now, for years in the car insurance business and in many lines of insurance, states have known what to do. They create a insurance pool. I think Ken Conrad calls it co-ops. You would create a state, and you have to do it by state because every single state has passed laws that require every policy in that state to have a particular thing. It might be testing for breast cancer, it might be testing for colon cancer, but every state has those. So you have to respect those peculiarities. So you would then form it, and you would say, okay, if you can't get insurance, you can't access insurance, then you can apply for this pool of insurance. And it would be big enough to where you'd have a pretty big group. Insurance companies, private sector, would bid on the management of that and bid on that contract. Competition. Medicare Part D. Nobody thought Medicare Part D would have a premium of $20-something when it came out. Everybody thought it would be $50, $60, $70, but because it was let out for bid and there was extreme competition for those policyholders, the premium came in very low. Then you would go in and means test that. So if a family of 4 made $38,000, they would go in and say, my company doesn't provide health insurance. Her company doesn't provide health insurance. Our kids are on chips. By the way, 14 million people in America qualify for Medicare, qualify for Medicaid, or chips, and are not enrolled. That'd be the first thing we do. And Dalton knows how difficult it is, and Cliff, how difficult it is to just get them to enroll in the program.
Who pays for chips and Medicaid?
Oh, the federal government's paying.
All of Medicaid, they pay for everything on Medicaid.
Well, there's a matching system, but, I mean, the public does. The state pays part of it, and the federal government pays part of it.
Medicaid doesn't cover adults in the state of Texas.